Hello, this is Dr. Robert Siegel, a urologist with Chesapeake Urology. Today, I will be discussing circumcision with you, and specifically what you need to know prior to your procedure. What is a circumcision? A circumcision involves the removal of the foreskin, which is the skin around the head of the penis. What are the reasons why a man would want or need a circumcision? Recurrent infection of the foreskin, called balanitis. This is characterized by painful swelling or redness of the foreskin. The inability to retract the foreskin, which is called phimosis. The inability to replace the foreskin in its natural position, which is called paraphimosis. Any abnormal appearing skin lesions, personal choice, or for religious reasons. The alternatives to a circumcision include doing nothing or doing a partial circumcision, otherwise called a dorsal slit, where instead of removing the entire foreskin, a slit is made in it so that it can be more easily retracted. What are the risks of a circumcision? Bleeding, pain, infection, change in penile sensation, the removal of either too much or too little skin, the need for revision surgery, and meatal stenosis, which is the development of narrowing of the pee hole, making it harder to urinate. The procedure can be performed under local or general anesthesia. Local anesthesia is most commonly performed and includes the injection of local anesthetic at the base of the penis and around the penile shaft. If performed under anesthesia or IV sedation, you will need to fast starting the night before the procedure. You will need a preoperative exam, which includes a history, a physical exam, blood work, and an EKG. These are to be done by your primary care physician. You will need a ride home from the procedure and a responsible adult available for the first night after the procedure. Certain medications, such as blood thinners, may need to be stopped several days before your circumcision. The procedure is usually performed in a Chesapeake Urology Summit Ambulatory Surgical Center. These are usually either adjacent to or in close proximity to your urologist's office. These centers specifically are for outpatient procedures. Some patients may need their procedure performed in a hospital, usually due to medical conditions. What does the procedure entail? The patient is brought into the procedure room and placed on the table. You will be comfortably placed in the supine position. Local anesthesia will be administered via an injection at the base of the penis, followed by an injection around the shaft of the penis. If sedation anesthesia is requested, it will be administered by a board-certified anesthesiologist. If sedation anesthesia is administered, you will need someone to accompany you and drive you home. A circumferential incision is made around the penis. The skin is removed and cautery is used to carefully control the bleeding. The skin is then precisely sewed together with multiple stitches that will dissolve over 4 to 6 weeks. The procedure usually takes between 30 and 60 minutes. Postoperative instructions will be provided. In terms of the post-procedure recovery, the penis may be wrapped in gauze or a bandage when you awaken. The gauze or bandage is usually removed 1 to 2 days after the procedure. The stitches are absorbable and will fall out on their own. Swelling is present for the first 1 to 2 weeks. Typically, it is recommended to refrain from sexual activity for 1 month after the procedure. Urination should not be affected. You may need to wear loose-fitting pants for several days after the procedure. When you are discharged, your physician may prescribe a painkiller, a topical antibiotic ointment, an oral antibiotic for 24 hours, and a stool softener. Things to let your doctor know about. If you develop a fever greater than 101.5 degrees Fahrenheit, chills, nausea or vomiting, severe pain, the inability to urinate, significant swelling, separation of the wound edges, or uncontrolled bleeding. The pre-authorization process is essential. We will communicate with your insurance company to determine your coverage and any copayments or deductibles that you may owe. We will provide you with an estimate of any charges that you may incur. All charges are due prior to the procedure. Payment plans can be arranged as well. How do you get scheduled? A surgical scheduler will give you a date. You may need medical clearance with your primary care physician or internist, including a history and physical exam. Additional testing may include blood work, an EKG, or a chest X-ray. You will receive a letter with all of this information as well as where and when to report. Is there special preparation for a circumcision? If you are receiving sedation anesthesia, you should not eat or drink after midnight the night prior to the procedure. Our nurse will call and discuss medications to take in the morning prior to the procedure. If you are taking a blood thinner, please let your surgeon know, as special precautions may need to be taken. Never stop these medications without a discussion with your primary care physician. Aspirin or Plavix, Coumadin, Xarelto, Eliquis, or Pradaxa. Arrive early, usually at least 1 hour prior to the scheduled procedure. If you are receiving anesthesia, make sure that you have a ride home. That person must come and stay the entire time of the procedure. We hope that your procedure goes well and that you have a speedy recovery. We appreciate your feedback regarding your procedure as we are always trying to improve the care that we provide to our patients. Should you have any questions regarding your procedure or recovery, please contact your Chesapeake Urology physician's office at 877-422-8237. Thank you.